Maria. Is on. You're welcome. Hello and good afternoon, everyone. Hello, hello. I want to take our topic today. You have the rights to request an interpreter and what you need to know. My name is Debbie. That's my name sign.
Good afternoon, everybody. I'm so excited to see all of you here. My name is Dr. Jana Hasko, and I'm the current director of Life Science. That is an interpreter referral agency. I'm really excited to see you all here today.
Right, I'm one of the community advocates downstairs at GLAD.
So I'm wondering, why did you come to this event? You have rights to successful communication in all public spaces. Are you aware of that? There are two laws that are important for us to know about. The Americans with Disabilities Act, the ADA, say the pronunciation, and the Unruh Civil Rights Act. The Unruh Civil Rights Act applies here in the state of California, but these two laws together guarantee your rights to accessibility, to communication with non-deaf individuals.
Effective communication for those individuals with deaf. Deborah will go more into that. We're going to go using the slides from here on out. So, who provides the services, what services are provided, why, and why is the law, and how you should request an interpreter.
First of all, we're going to be talking about who provides interpreting services. I'm going to take this opportunity to talk a little bit about Life Science. Life Science was established in 1968. It's an agency that serves Los Angeles County. We provide interpreting services in 10 counties. You can see them here on our PowerPoint. Los Angeles has more than 250 freelance interpreters who work as independent contractors. We assign freelance interpreters to assignments where you have requested interpreting services be provided. So again, 250 freelance interpreters work for Life Science. There's another important piece you need to know about us here at Life Science. We are nonprofit. So the money that is collected for interpreting services is handed over to the Greater Los Angeles Agency on Deafness.
And that's part of the community advocate services that we provide to you.
It is a full circle to supporting the deaf community in Los Angeles. So the money that we earn here at Life Science for interpreting services and then fed back into the deaf community. So that money then is recycled through the agency and given to GLAD to provide support services for deaf individuals.
Correct. What do the services look like? Video remote interpreting, that can be online, cart services, interpreter services, in person and otherwise. Deaf, blind, tactile and or pro-tactile interpreting. It's most important for you to pick what's comfortable for your services and your needs. You know, make sure if you need tactile, that's what you need to request. If you prefer a CDI to to work with you, maybe your background, because of your background, or your language accessibility. So you can request a CDI as well. It's important that you have that as part of your request.
Absolutely. The law states clearly that you have a right to effective communication. That means that communication should be in your preferred modality and comfortable for you as the consumer to use. The ASL interpreter is there to match your style and your language needs. And I see all of you in the audience shaking your head in the affirmative, so you were with me today. So when you request interpreter in interpreting services, it's your right to have it provided to you, whatever mode or whatever style is best for you, the consumer.
Absolutely.
Before we move on, I want to talk about the services that Life Signs provides. We have in-person ASL interpretation. We have remote services. We also have emergency services that are provided. So when you request through Life Signs, please make sure you're thinking about scheduling in advance. Someone from the audience said maybe 1 to 2 weeks in advance. Dr. Haskell was saying, whenever you know there's an appointment, just go ahead and book with us right away. There are, I had said earlier, 250 interpreters who work for Life Signs.
Sometimes the
But-
interpreter's schedule is full, and we might need that one interpreter.
So due to scheduling issues, it might be really difficult for Life Signs to secure an interpreter. So as soon as you have that information, please share that with us so that we can book those interpreters. The question was, can we do VRI services? Can we book that? And Dr. Haskell was saying, absolutely, that is something that you can book. We do have VRI services available to those of you who want to request that. And the company, and the business can request those services from us as well. There's an audience member saying that they prefer VRI services, which is great. And the rationale behind that is that it's faster and it's easier.
That's interesting. It's important. It's individual. So,
I mean, just remember the law, right? It states that it's your preference, that the deaf individual has the preference of communication style and modality.
so when you're requesting an interpreter, like maybe where, your school, and a lawyer's office, a university or a college, DMV, Social Security office, any of those things, et cetera, et cetera, et cetera. So a request, you have a right to request those interpreters. There's not a limit to how many people will say, they can't really say no. You have a right to request those services because it has to be access, equal access, and equal style of communication.
This holds true for all public spaces. Let's say you're going to a concert hall. You can request a sign language interpreter.
Yes,
for that.
yes, you can.
If you go to the DMV to renew your license, you can request an interpreter for that. Going
Yes, you
to
can.
a salon, what do you think? Going to a salon for a haircut. Somebody in the audience said I wasn't aware of that. And there's a question about, is that for last minute appointments? And the answer is, the longer you wait, the harder it is for us to find an interpreter. We might not be able to fill it if it's too last minute.
And Deborah's saying, yes, there's about 2 weeks you might need for that interpreter. It also includes churches and other religious services. Maybe they have a presentation during Christmas time. You can ask for an interpreter.
If there's a parent-teacher conference, that is required.
And job interviews.
The IEPs that go on in the school system, if they're hearing for non-deaf students with deaf parents, they can request interpreting services for those IEP meetings.
And for the police and other law officials, deputies, those sorts of things. You know, those are high priority needs.
Absolutely. What were you gonna say? There's a question from the audience. If you go to a salon, can you request an interpreter? Who pays for that? Does the salon, are they required to pay?
Yeah, the salon is required to pay. The deaf and hard of hearing individuals who need that communication access are not required to pay. Sorry, there's a side note of conversation going on over here.
The Unruh law that we talked about, the Civil Rights Act that was passed here in California, it states that it doesn't matter how many employees work for that company, you can request services. If you remember, the ADA requires a certain number of employees to be working at a certain company for them to pay for interpreting services. But with the Unruh law, Civil Act,
If
you're
we have
able.
rule law, it doesn't matter how many people are there. You have the right to request the services. Another question from that, really maybe that a business can't afford to pay that play.
So the question was about the affordability of interpreting services. They can deny services based on undue hardship. That is certainly in their purview to do that. However, they have to verify and supply evidence that it is absolutely an undue hardship for them to provide those services. The Unruh Civil Rights Act tells them they have to document, they have to say that they have denied interpreting services and explain the reason for the denial. If they state that they only have 2 employees and they can't afford to keep their doors open, if they bring in interpreting services for a client, they have to support that with documentation to verify that
Deborah's adding,
information.
yes, it is. From the audience again, they have the right, they have the correct reason for that one.
That's right, they have to document the reason they don't provide those services. And they have to provide it to you as the person requesting those services as well.
Doesn't
I
mean
know
that
what
you
you-
can't pay for parts of the services there. You can ask. You have the right to ask no matter what for those services. If they deny it, you ask them to put it in writing, why they denied it. And then you give it to me, and then you give it to Deborah. I'm one of the community advocates here. I work as one of the community. I'm happy to work with you anytime. I will work with you and discuss what to say. Don't worry about it. I'm happy to help you fill out the information, get it to the English correctly, and submit that request for the interpreter.
Go ahead with your question. Once that paperwork is given to the community advocate, what happens with it?
So she's not responsible, she's responsible for providing the interpreters. I'm responsible for fighting the disagreement in regards to filling out the complaint, that's my role. We have other community advocates as well, not just me, but they'll also be happy to work with you as well in regards to those issues.
We are often contacted from the organization asking for interpreting services. They are responsible to contact us. So we schedule those jobs, we take down all the information and the details, we send a blast out to those 250 interpreters on our list, and then again, depending where they live, their qualifications, they are filtered out so that we can find the most qualified individual for that assignment. Once the interpreter is assigned the job, or that's when the interpreter is assigned the job and then they show up and do the assignment. There's a process that we have where they close the job, and then here at Life Science we are told that the job has been completed, but that information goes to payroll. One perk for working with us is that interpreters are paid weekly. Other agencies are not. They do not pay weekly. So once that interpreter has has been paid for that job, we bill the company, and then we turn that money over to GLAAD to use that money for its own purposes.
How many interpreters are active in that area?
Okay, I can only talk to Life Science. We contract with 250 interpreters. And the person in the audience said that is not enough. And so the question is now, how many interpreters are in the area? So here at GLAAD, we have 3. We have those who work for GLAAD, there are 3 staff
Yes.
interpreters.
Who work here for the agency?
Mhm. That's it, that's what we have. However, so we don't just refer those 3 out. We contract with 250 individual interpreters in the area.
Deborah's saying, yes, we partner with them.
So we partner with them. They're independent contractors. So they are the ones in charge of making the decision whether they accept that job or not. So if there's a request for interpretation, my team here talks with the company or person that's requesting those services to clarify what type of assignment it will be, whether it's in the classroom, if it's in a salon, regardless of where it is. If there's gonna be support information to help that interpreter prep for the job, so that we can pass that information on to the interpreter. That is all information that is gonna benefit the interpreter in that one assignment. Of course, and interpreters have to follow the CPC, Code of Professional Conduct, which means that the interpreters have to select jobs that are on par with their skill and experience. If we look at the legal field, for instance, or the theatrical field, interpreters have to have experience in those respectively to accept that type of work. And specifically for mental health, the interpreters have to really make the decision. Are they appropriate? Are they skilled enough? Do they have the toolbox to have a successful interpretation in a mental health setting? So the more information that we receive from the hiring body, the better off we can screen our interpreters and make sure that we have the appropriate placement. Here at Life Science, the priority is quality. We want to make sure that your access to effective communication is high on our list, and we do that with quality interpreters. We want to look at the deaf individual's preferred language. That is a big, important part to the decision making. But what makes it tricky is it's the interpreter, the independent contractor, who makes the final acceptance of the job. So we have to make sure that they're making judicious decisions when accepting work. We don't have control over that. Somebody in the audience is responding, saying that's amazingly complex.
Are we all good here? Oh, we have another question from the audience. When I went to the doctors, I had a lot of problems, but interpreters didn't show up. They had to go by and replace it on the phone or video. You know, it was all very blurry, the screen wasn't very clear, it was very frustrating. So that kind of situation was very difficult for me.
So what can we do in those situations?
So if that happens in your situation, that person, you can work in the office, they're supposed to call and how to get an interpreter, or call for tech support in regards to the video to get that resolved quickly. Audience Gwen is responding, it's a technology issue on the phone. So, yeah, so they have to, Deborah is saying, you know, it might be a temporary closing, including something included in the video services that they're using.
Yeah, but I've had that, you know, this was a problem that I had, an audience member is saying, I'll call you this week because I have an appointment next month, so I'll go ahead and get on the schedule.
We'll call, and I'll help you call your doctors to set up that appointment.
Another person is asking about VRI. Who makes the decisions around VRI? Dr. Haskell is saying it really depends. times we have on-call VRI services. Those can be scheduled in advance. Other companies and organizations and hospitals, they contract out with different referral agencies. So, kinda depends on where you're at. So Life Science does have VRI, and we know that we like the speed of we have to have the appropriate speed of the internet. There's equipment that we need that's specific to VRI work that is required. You know, and sometimes technology isn't always our friend. But we need to have individuals reach out and contact us regarding VRI work.
Audience member saying another question. The interpreter preferred, like I have a preferred interpreter. I don't really like that particular interpreter. That interpreter, but that interpreters, you know, they're fine, whatever, we go along with her person. But this interpreter, you know, they kind of go back and forth, they don't like each other. So some people prefer a particular person for their interpreter, that's fine. Some people prefer VRI, that's their preference. But really it's, you know, some people kind of consider it a confidentiality. They want to hurry, they don't want to go in, they just want to get that done, and that's what VRI is for. Some prefer in person, they want that comfortability of being flexible with the style of signs. Going back to this, no, the interpreter doesn't show up, oh, that makes me very angry, you know, when the interpreter doesn't show up. You know, keep canceling the appointments, the interpreter doesn't show up. You know, I'm saying, you know, sorry, the interpreter doesn't show up, they don't know what to do. That's why we're here as a community advocate. Come here, talk with me, we'll work with you, we'll call and explain the situation to your office, whatever services you're going to, and then also educate them in regards to how the process works. And then provide them with a better understanding of the laws as well. Make sure they clearly understand everything that go, and maybe they'll be able to sort of back up and support you in what your needs in your interpreter appointment. Hopefully, you know, mostly we can be successful in that, but you know, no guarantee.
And you need to remember that interpreters are human as well. Sometimes they have issues with their scheduling. Sometimes interpreters give back work at the last minute. And that could be due to illness. So again, we have to keep in mind there's a variety of reasons why an interpreter doesn't show up. And we're hoping that the interpreters that work with Life Science are showing up. We work very hard here to make sure you have access.
Question in the back. If you can go back, I'm sorry I missed that little part at the beginning. I meant to ask you, if any consumers have the right to request an interpreter for like a funeral, a family meal, or like Thanksgiving, a wedding, etc., is it possible to request an interpreter? Or must the family member, the facility ask, or is it the self-ask? It's an individual interpreter request. Okay, so let's explain briefly. If it's a family wedding, a family event, after school program, you have to request an interpreter to those who are responsible to pay for the interpreter to show up. The individual doesn't pay. The reason why it's the law states, the Unruh Act for California, they have a right to request those services through the facility.
It's been my experience that if a deaf individual has a wedding to attend or a funeral, they request interpreting services themselves and pay for those services themselves. Because it's a private event. The law covers public spaces, and that's the difference.
Question over here on the other side. If like it's a wedding, or my friend knows a little ASL, and they place them up there, but really they're not really an interpreter for that one. But they do attempt to interpret the situation. You know, they sit and kind of go, interpret for me, is that okay in these types of situations?
You're talking about a volunteer interpreting situation. Keep in mind that interpreting is a profession. A friend can help with communication. I
Deborah's
mean,
having
absolutely.
basics.
But that's different than a professional interpreter. So sometimes friends do volunteer to interpret. And sometimes professional interpreters volunteer for their friends' funerals or weddings or whatnot. So contact your circle of friends. Maybe reach out to them for your private events. But what I'm saying, if you want a qualified, certified, skilled interpreter for effective communication, I would request services through Life Signs.
Deborah's adding in there. I see your mention for a family member signing. That'll be basic information, for example, like she said, you know, oh, we have a celebration, our first meeting, and then that's enough. Basically, they intake information, they don't say anything necessarily. It's not simultaneous communication that everybody celebrates. But they don't say anything through the entire conversation.
Yeah, I feel like often deaf people are left out when people are volunteering. And somebody in the audience said that this was her experience before. There was one interpreter that I decided not to work with anymore because of the lack of communication during an event.
I'm sorry you had that happen to you. So, you know, that's happened in the past, so.
And you have a right to fire your interpreter, to not work with that interpreter again, because we go back to the law that states that they have to match your mode of communication, your modality, and your style. Deaf individuals do not have to accept a good enough access to communication. The law requires equal effective communication accessibility. That is your right.
You don't have to pay for the interpreter. What do? You're stuck. Deborah's saying, you know, you don't have to pay. You have a right to equal access. If, for example, you're going to a private event or a private wedding, a very small, intimate wedding at somebody's home or at a small church, you know, maybe the family would be willing to pay, or the facility would be willing to pay. Or asking a friend or a family who wants to volunteer to sign for you, that's great, they're very excited to do that. How to request for college students, you know, they take ASL classes, they want to get their practice and their practicum in and their training in, and they want to have some signs, you know. They might be skilled for that type of a small intimate affair, and it's free. Nodding along the head.
Here, yes, please.
So as you mentioned before, based on my experience, you know, I couldn't afford an interpreter in the past. One of my friends contacted CSUN, California State University in Northridge, and many students who are motivated and they kind of want to volunteer, they're very eager to volunteer, they're through their interpreter training program. You know, they look for like different parts, you know, they go pair with them for the apartments, to look for apartments in around the area, and they help with them. It's better than nothing. You know, it's better than no language access and no language communication. I think that's a great idea if you ask, you know, those students who are in a practicum program, you know, they get their community experience through there. Deborah's saying, right, that's right.
Dr. Husko said absolutely a good idea.
We'll go ahead to the next slide.
We have contact information for all of the interpreter training programs in Southern California. So if you're looking for some contact information, please let me know. I'll be happy to share that with you and support your reaching out to them for student interpreters.
We have more slides. We want to get to the next slide. Hold on just a minute to your question, just till after the presentation if you don't mind. Okay. After, hold your questions, and then we'll go ahead. Okay?
But I love the conversation that's happening here. It's good information. Your questions have been fantastic.
I agree. It's really wonderful questions. So, but we'll hold them until after the rest of the presentation. So we'll get back to this.
Great.
I know it can be extremely frustrating to hear, no, we can't afford it, or we don't provide interpreters, no, and then they send you off to some other place. That is discrimination, 100%, period.
It is illegal to tell you no. Particularly because the law says you have a right to effective communication. That's what the Unruh Civil Rights Act tells us. It's, again, specific to California, and you're very fortunate to live in the state. Other states do not have this as a right. So that means small businesses here in California can provide accommodations and accessibility to whatever they're providing. They can't tell you no. And here at Life Signs, we have sister organizations that are connected with GLAAD.
Right.
So you can access services here to advocate for yourselves, and you can learn more about the law. And when you know more, you can do more. You can go out into the community and use that information, share it with your friends, educate other people in the community about their rights. Non-deaf people
Don't know about ADA or the laws or the rights.
Hearing people don't know. Non-deaf people do not know. So you have an opportunity to educate all people about the rights of deaf people and communication and the law. It's your language, it's your experience, and it's your right to accessibility.
So what if it's an event or whatever, and requesting an interpreter in person, if they denied that, then how can you take the next step for having, you know, the fact of the denial, where you get that evidence from? So if you have a recording on your video, or maybe it's a Zoom call, sometimes you can do that. If the question is going on, you know, how you can do that? Say, how can, in person, how do you provide evidence or proof? It's like keep a paper trail back and forth. Like going back, you know, saying, oh, you know, bring your friend. If they write down, bring your friend. Or we can't help you, or whatever that proof is.
And somebody in the audience is saying, that doesn't work.
You know, take that paper as proof.
An audience is saying,
Proof
I
is-
think that evidence is worthless.
So, you know, have a written complaint. They have a complaint process there. You can analyze, find out what that is, and, you know, assess the reason and find evidence for that.
Data is important. That's why the paper trail is so key. You have to show evidence.
And who?
And remember, the law requires businesses to tell you in documentation that they have denied services. Also, if they continue to deny it, where can you go for support? Do you know where? Right here. You would come here and talk to GLAAD community advocates. That's why we're here, is to support you in that process. They have contact information, they have experience, they know how to navigate the process, and they're here to fight for you. So please, if you're struggling out there, reach out to our community advocates.
Really, I want to let you know, if you come here, we're all happy to work with you, and we can educate the community. If the future happens, if you're denied, you're told no, we can tell you what the next steps are. You know, you can talk with a manager or a supervisor in that one, or whatever. You can tell them, if they say, oh, they're not here. You can go ahead and say, oh, well, no, I need to talk to them now, or I want their name, their contact information. You know, be persistent, be there to make sure that you have access. Make sure you tell them you want to speak to the manager regardless. They'll get back to you, if they're available, put them on the phone, if not, you have to get back to that person. And go ahead and call the headquarters, if those things are a failure, call the headquarters in there and explain the situation. Sometimes you have to fill out the form online, or print it and fill it out, and then send it to them, or email it to them, or fax it to them. And then, you know, really, maybe your English isn't that good, still, come here, we can help and support you and provide you with that service to navigate through that pathway.
Right now, Life Science working with GLAD to develop resources that is user-friendly and explains how to file a grievance against an interpreter. There's a step-by-step what to do. So online, you'll be able to navigate your way through filing a complaint. So instead of that, on the paper, there'll be a QR code that you can scan, and then you can see it in sign language. So you'll have it both in English and in ASL. That's a project we're currently working on, so soon it will be uploaded to our website, and you'll have access to that.
I know, I have to hold my questions.
Yeah, right now we're developing it, but this is a resource for the community to take advantage of. We'll have one about the rights, the ADA, and accessible communication. This is something that you can give to businesses and corporations when requesting interpreting services. There's a QR code that they could even scan, have it in American Sign Language, and it's the same information, but in other languages. And the other resource is how to file a complaint. Both of those will be uploaded to the website soon, so keep an eye out. One person's very excited about that. All right, let's move on, we're running out of time. So, what do you do to request an interpreter? Do you call Life Signs and say that you need an interpreter for an appointment? I see all of you are saying no, that is not how it works.
You know, we can do a call, we'll do a mock call right now.
Okay, let's do it.
Making a video call.
Hello, I'm an interpreter 948791. I'll call for you.
Please, go ahead.
It's ringing. Hello, this is Dr. Wong's office. How can I help you today?
Yes, I'd like to set up an appointment. Okay, great.
Okay, great. When are you available? What's your name and birthday?
My name, I am Cam. My birthday's 11/7/1972.
Great. I see that your file is here. What are you requesting the appointment for?
I have a follow-up appointment.
Perfect. Are you available in 2 weeks? Tuesday at 9?
Yes, I'm available at that time.
Okay, I've made that appointment. I've set it up. I appreciate your time. Do you have any other questions?
Hold on just a moment. I need an ASL interpreter for the appointment.
An ASL interpreter. You're bringing one with you, right?
No.
Well, how do I provide an interpreter?
So, if you would please go ahead and contact Medi-Cal or Medicaid, the Medicaid insurance. You'll have my information, the phone number on the back of the card, the interpreter can bring it up, they'll have it in their system, in their doctor's office, and then they'll be able to call. Also, or you can please contact to Life Signs agency. They'd be happy to explain to you the system for setting up an interpreter. Provide the phone number, 382-119-5112.
All right, so to clarify, I need to look at your insurance card. And I call that number and request an interpreter through the insurance agency. And then I call Life Signs Interpreting Agency, I tell them your name, the time and date of your appointment, and they'll schedule that? And then that's it?
Right. So when you call either Life Signs or the insurance company, explain, they'll tell you whether or not you need the name of the consumer, what type, what sign, style, ASL, what location, date, time, etc., how long the appointment will be. They'll ask you all those kinds of questions. And they'll explain the rules in regards to payments, forms, and everything else. If it's a health insurance will take care of it and pay. So you can tell them it's an ASL interpreter request. That's process. That's something you have to inform them and be ready to set up that information to go ahead and get it set up.
And then the interpreter will just show up.
Please let me know.
Okay, I'm gonna try. This is the first time I've ever had to set up an interpreter. So I'm gonna make the appointment, but if there's a problem, can I call you back?
Yes, please do. That's fine. And again, I'll explain it to you.
Perfect, thank you. We've got you all set.
Great.
Thank you.
You're welcome. So who pays?
We discussed this a little bit earlier. Who pays for interpreting services? It could be the health insurance company. I see a lot of you saying that.
The company out there itself.
Right, the company. Kaiser, which is the specific hospital name in the area. Just the Red Cross will pay if it's a Red Cross claim.
Explain all the different hospitals, the different agencies. Technically, it's the health insurance who reimburses the hospital to pay the interpreter. It's the responsibility of the hospital to request the interpreter for you. We have a hand in the back.
We've got lots of hands going up here.
So, one of the big Medi-Cal providers, like say, you know, they're already accustomed to finding an interpreter, getting an interpreter matched for your situation. The problem is small clinics, small doctor's office, like dental offices, those you have to call, often say you have to call yourself. So the consumers come into the advocate's office to request contact, please call my interpreter. I've been thinking if the insurance companies can develop an online request system for ASL interpreters, rather than requesting something when you call, you know, as the time goes on. You know, you're waiting on hold for 40 minutes, many hours, or holding and holding and holding. Really, we don't have the time to sort of put on hold for that entire time. Medical offices should find a better way to make it more cohesive and more fluid in their say, rather than doing it on their own. Yes, they could be doing that. And that's how the problem can be solved.
I have an idea, I'm just gonna throw it out there. When you contact those offices, give them our information here at Life Signs. Then they can request interpreters online via our website. I mean, the office can do that, they can contract with Life Signs. I mean, that's one suggestion I can.
Oh, yes. Did you have a direct contract with Life Signs? Better than through the health insurance company?
We bill a little bit differently. So with Life Signs, we have insurance that we bill for payment. We contract with different organization and we bill for payment. But they have to contract with us. They have to request services from us.
Yeah, there are some of you who have hospitals, some in the area, already have agreements and partnerships with Life Signs. So they can also partner with them more hospitals. If there's no partnership, meaning they have to request the health insurance to call, and hopefully the health insurance has a contract with Life Signs and sends it up easily through there. We have a question in the back.
Very helpful.
So, such as before, like my dentist in particular, is a very small office, it's not a big company, it's a small dentist office. Typically, they don't normally request an interpreter, they never really have. How does it work, how do I approach them? The instructions, the company, you know, they don't know what to do, they've never contracted with an interpreter or contracted with anybody. How can they handle that going forward? Then, just, I don't know, and then just move it on, going out in that area. You know, cut it off down to a simple solution. How can you do that rather than pointing around for a small clinic or a small office or a small organization, etc.? That's really the key to that. So really, as we just recently mentioned, the Unruh Act is for California. Again, it doesn't matter the size of the agency, depending on the requesting the term. 15 people or under, that's for ADA. With the Unruh Act, it's a little less than that. So that's following the laws here in California, unfortunately. So we're not aware of that. What if they're not aware of that law? So it means they can be more education than myself, a deaf person, providing that education. Another side comment saying, yeah, that's true, I don't want to have to provide all that education. Best Like GLAAD or Life Signs together start in the community, going out in the community to small clinics, dentist office, et cetera, than the deaf person putting the responsibility on themselves for that. That might be a better and a more effective way for it to be done.
Yeah, I'd like to speak to that. You know, I agree with you 100%. That's one reason why we're developing resources online. I want to make sure that you all have those resources in your back pocket, whether it's a printed paper that you take to the office or the company. Give them the information because it explains the Americans with Disabilities Act. It includes the update. It also includes Unruh. So you will have that information that you can provide to the caregiver or to the business. And mind you, you don't have to go into great depth when you educate people. You can just have the paper printed out and you could show it to them. I mean, it's a sheet of paper that says you have rights to a sign language interpreter. And there's a code that connects them with us. That's it. Or when you're making an appointment, say, okay, now what you need to do is call Life Signs and schedule an interpreter. It's on them. They're the ones that have to contact us. And then we work with the company to educate those individuals as to why an interpreter needs to be provided in this situation. We're going to continue to work with the business. And if it becomes problematic, then we have an advocate, and you want to reach out to Debbie. And we have a great partnership here at Life Signs and GLAAD. We're very fortunate that Life Signs is connected with GLAAD because we provide services and access to communication, and then Debbie fights for the rights of deaf individuals. So we provide the access, and Debbie's the one that fights for it.
As well, don't forget the resources that we have at the back table that we're giving out over here. It's important that some that are helpful for you to keep, you know, whatever you have, maybe the information you give them, they can let them take it down and take a copy of it or take a picture of it, and then you keep that information. You can use it in the future. So, you know, as she said, stated, that's ability to educate, that one.
Okay, moving on. And now we've talked about a little bit about denial of services. We talked about the importance of documentation. So you can come to GLAAD and get support from the community advocate. Bring your documentation with you. Online, there is a link to file a grievance with the ADA. And the resources that I've talked about will include all of the information, the step-by-step information to file a grievance.
Yep, as we just recently explained, we're just kind of reviewing it here. I know many of you have experienced that frustration with hearing that word. So you can, and we are happy to work with you on that one and fight and go through that process.
Great. So we have resources for all of you. The information, the educational pieces are in the resource. It's everything you need to know, to share with companies and organizations where you're requesting interpreting services, regardless of what type of business that is. So our resources explain what interpreting is. It explains how to request an interpreter.
I wanna add that you can, you know, your friends who are deaf and hard of hearing, whatever it is, you can give them. You can educate them about what you heard, you can give them a resource, give them a card, give them a brochure, and spread the information out to the community. So, you know, more help to build the awareness that's going out there, so people don't feel challenged or frustrated, you know, it's enough of that. So, it's really, it's frustrating, yes, with the communication access for deaf. You know,
You're deaf. I didn't know, I thought you were hearing.
Yep, so it's hard to navigate and go through that system. So it's also, we've experienced the same thing you've experienced with regards to communications when it comes to interpreters. You know, you have your rights and you are equal in those rights. Partnership in San Diego and LA. Bakersfield too, we all link with that area. Yeah, we do have partnerships in different areas, but more focused on, San Diego has its own agency that's focused on, we're focused on providing in our 10 counties that we work with. From time to time, we do focus on those for the intake in our regional services. You know, we may not have the information directly for like San Diego or San Francisco or any other agency. We might have to work with you to transfer that case to an agency that has better services. So we have 5 service providers. Bakersfield GLAD, Center on Deafness in Inland Empire, Cody, Tri-County GLAD, and Santa Barbara, Inyo Mano, and San Bernardino.
There's 10 counties that we serve. It's a very large area. We opened up with the graphic. We have 5 sister agencies here that were just listed by Debbie. It was Cody, the OC Deaf. There's so many resources. We have those resources to share with all of the people. So brochures, business cards, a list of resources are in the bag. Feel free to collect those, take a bag, share the news with all of your friends. You know, spread the word about the rights. And specifically, when you go into a business, you can require interpreting services and share that information with them so they know how to get interpreting services for you.
Right. So right now we'll take the final question. So there's one more comment or question that's over here.
That's a little long, she's saying.
In the back. So, if you're pulled over by the police, do you have a request an interpreter, you know, they have no way to communicate if you're pulled over while you're on the road. So, you can text back and forth or whatever. Is that breaking, you know, my Civil Rights Act, my civil rights? It's important if you're deaf or hard of hearing to say you need an interpreter. You know, then, oh, well, we'll write back and forth, but they'll talk on the radio. There's really no excuse for that. You repeat it again, I need to request an interpreter. You can give them a phone number for a life science card and let them call through there.
Yeah, if I might, keep in mind, the law says that you have a right to accessible, effective communication of your choice. So if you requested an ASL interpreter in that situation, I would add that I'm requesting a certified ASL and qualified ASL interpreter. Does the California law have a stipulation for the skills of an interpreter? Is there any prerequisite?
Audience is responding with no.
That's right, but we have a national standard that's set very high by the Registry of Interpreters for the Deaf. That is a certifying body of the interpreters who work throughout the country. So interpreters getting certification have jumped through the hoops to show their skills. And so when you're requesting interpreters, specifically in that scenario, ask for a certified interpreter.
Right, okay. So, question that just maybe put out. In future you're having education purposes, like advertisement flyers, community education training, maybe in future, a bails bond advertisement, like, you know, flyers out on the road, the side of the road where you see bails bond, you know, if your office, big businesses, send it out there. Maybe just do contact people that have time to watch better and clear, send it out for that individual to get. We can definitely recommend we do something like that and send out a mailing. That's why we're really talking about many different ways and many different avenues we can get that information out to the community. You know, we need the word to spread more.
Some of the work that LifeSign does is going to events and educating individuals. We're going to be having the Olympic Games here in Los Angeles. So we went to a big event for the Olympic plannings, and we passed out brochures, we gave out our business cards, we contacted the airport. We've tried to educate people to say, we are here. If you have deaf employees, please contact us. Or if there are people that want to use your business, contact us. So for whatever reason, we're trying to get LifeSign's name out there so that deaf people are served during the Olympics. We are definitely promoting our services. We want to work with the community all in the name of access to communication for deaf individuals. So you saw our table when you walked in, right? And here we have our beautiful table cover. We take this to events and we talk about the services that are provided. So we educate the larger community on interpreting services, and this will continue to happen.
Yes, it will, definitely.
Right now, we're partnering with NorCal for disaster response interpreter training. LifeSigns is the only agency in Southern California that has accredited, approved interpreters ready to respond when a disaster hits. So if there's an occurrence, then we can contact interpreters through LifeSigns to respond. We are the only agency right now that provide those interpreters. We are partnering with Southern California Registry of Interpreters for the Deaf for workshops.
To make sure interpreters are provided, to match them with their skills and match their needs that are out there.
So we're continuing to create partnerships within the community, and we want to recruit more and more interpreters to work for us, particularly those that are qualified and certified, because I want interpreters to show up at your appointment that you mentioned at the beginning of this. We don't want the deaf community frustrated by having interpreters that don't show up. We want to change that.
I completely agree. I strongly agree with you. One question in the back. Papa. Oh. I want to ask you, see if your LifeSigns works with Social Security. Okay, so our interpreters work with anyone, any variety of agencies, anyone throughout the entire area.
We're going to partner with anybody in any space who's willing to work for us. If an interpreter is requested, we will look to find an interpreter to fill that assignment. Absolutely. Somebody had mentioned weddings. I know that we've offered services at weddings. We provide services for the Social Security office all the time. So if a request comes in, we are looking to find a qualified interpreter to fill that space.
Correctly, I just want to kind of add to what you mentioned. As you said, the Social Security office, the Social Security office is responsible to provide interpreters for you. You don't bring one in with you. And they'll process their request through whatever association or whatever agency, just as you said.
We contract with many city and state organizations. LifeSign is the oldest and longest ongoing interpreter agency in Southern California. So we are here, we are in it to win it. We have been here in Southern California and we will remain here in Southern California. So use LifeSigns, everybody, get the word out. You have all the resources at your fingertips. Grab a bag, stuff it full of resources, and share it with a friend. When you request an interpreter, you can also make sure that you put down that interpreter's name and you can request them for other assignments. If I were to request interpreters, I would put these two down that are here with us today. So thank you, everybody. Thank you all for coming.
Thank you all for coming. Have a wonderful rest of the day. When you're here, what are you doing again?
Okay, so on the flyer, there's a QR code, just like what is here on the table cover. You can take a picture of that with your phone, and then there's a link that's gonna show up. If you click that link, all the information will show up.
Great.
Thank you, everybody. If you have any more questions, if you need anything, my office is right down the hall. Come see me. The question was if LifeSigns has enough interpreters. So like I said, we have 250 contracted interpreters, but we are always recruiting. We go to different events to try to recruit. We'd like to, you're asking for 1,000.
1 million.
1 million interpreters. So we're partnering with a lot of different colleges, a lot of different training programs in hopes to foster the next generation of sign language interpreters so we can keep them coming along. That is the goal of partnership, is education and communication for all. And we will not stop. We do partner with, CSUN does partner with LifeSigns. Oh, we're out of time. Hang on, we can take one more question. This is the last question.
Does LifeSign organization focus on California, or just in the, what part of the state do we focus on? Other areas use different areas of interpreters.
We provide services to the 10 counties that were on that opening graphic. So I haven't memorized all 10 of them yet. I'm new, I get a pass. We can go back to the map in the PowerPoint slide and then you can see the area that we covered.
Inyo, Mono, San Bernardino.
So here they are listed out on the PowerPoint alongside a graphic of the state.
San Bernardino, yeah. Santa Barbara, San Luis Obispo, Riverside, Ventura. Oh, that's the sign for Ventura, okay.
And there you have it. That's the area that we serve.
Other states, other interpreter agencies have their own agencies.
There's a lot of referral agencies out there. Back in the day, 1986, we were the only one. We were the first. But now it's become very, very competitive. There's a lot of different referral agencies out there. So with the passage of AB 5, interpreters have become independent contractors, which means they control their schedule. They decide to accept or not accept work for a variety of reasons. It's very complex. There's a lot of variables. There's a lot of differences amongst agencies, but we are unique. Here at LifeSigns, we use our profit and we pass it on to GLAD for community
That's correct.
advocacy.
That's what we do, pass it on.
We are a non-profit that gives all of our funding over to GLAD. That makes us very unique. Okay, y'all. Contact us after the workshop, okay? I look forward to working with all of you in the future. If you have any questions, email me. I've got a business card in the back. And please get advocacy support from Debbie. Thank you all again.